Welcome and thank you for joining us to learn about strategies for managing the nutritional and supportive care needs of your patients diagnosed with head and neck cancer. My name is Barbara Grant, and I'm a registered dietitian and a certified specialist in oncology nutrition. I work as the outpatient dietitian at the St. Alphonsus Cancer Care Center in Boise, Idaho. It is my honor and pleasure to present this podcast as a part of the Association of Community Cancer Centers education project establishing and improving cancer nutrition programs in the community setting. Patients with head and neck cancer often present at diagnosis with poor eating habits and pre-existing nutritional deficiencies due to the excessive use of tobacco and frequent heavy alcohol consumption. Many patients may also have constitutional symptoms such as anorexia or cancer cachexia, often a sore mouth or throat, or difficulty with chewing or swallowing, or weight loss is what prompts patients to seek medical care. Head and neck cancer patients have one of the highest rates of malnutrition among all cancer diagnoses, with 25 to 50% found to be nutritionally compromised at diagnosis. Acute side effects of combined modality cancer treatment can significantly affect a patient's ability to eat. Common side effects include xerostomia, loss of taste, mucositis, oral infections such as candidiasis, dysphagia, odonophagia, fatigue, and further weight loss. Some of these eating-related problems may go away after treatment, others may last a long time, and some may never go away. Long-lasting or late-occurring side effects of treatment may include permanent xerostomia, dental problems, trismus, esophageal stenosis or fibrosis, and aspiration. Quite simply, for a majority of patients, it hurts to chew and swallow, and it can be very difficult to eat before, during, and even after cancer treatment. Even before treatment begins, the entire oncology care team should strive to work together to proactively manage the nutritional and oral health of their patients throughout the continuum of cancer treatment. Teamwork to manage treatment-related side effects, to assess for patient safety concerns, and to advocate for optimal nutritional intake will help patients complete their therapy as prescribed without breaks, dose alterations, or unwanted hospitalizations. Here are 5 multidisciplinary strategies for maximizing the best possible patient outcomes. Strategy number 1, referral to the registered dietitian to identify nutritional risk and to outline an individual medical nutrition therapy plan. Patients have increased nutritional needs due to the demands of their anti-cancer therapy. Timely identification of nutrition risk is key for ensuring nutrition status as patients progress through their treatment. At diagnosis, the dietitian counsels the patient regarding his or her specific energy, protein, and micronutrient needs, as well as for strategies for maintaining weight and preserving muscle stores. From treatment through recovery, patients should be advised to maintain their weight, even if overweight. Cancer treatment is not the time for losing weight. Weight loss during treatment contributes to longer recovery times, continuing fatigue, and debilitation. In an effort to help patients maintain their weight and complete their cancer treatments as prescribed, dietitians routinely recommend the placement of feeding gastrostomies, or PEGs, to provide nutrition. It is recommended that tube feeding ostomies be placed at least 1 week before treatment starts. This will help decrease the risk of infection and to allow adequate healing time before patients become immunocompromised from their planned therapy. Regardless of whether a patient has a tube feeding for nutrition support or not, patients should be encouraged to continue to swallow nourishment and fluids throughout their treatment. Swallowing through treatment helps patients preserve their swallowing function. Ideally, the dietitian will monitor patients weekly throughout their cancer treatment and make recommendations as treatment-related side effects begin to appear. By seeing the patient every week, the dietitian can provide individualized counseling as patients transition from an oral diet to their tube feeding. Once the treatment is over, the dietitian should see patients regularly as they transition back to an oral diet. Strategy number 2, a referral to speech pathology for assessment and evaluation of swallowing safety before treatment begins. This is especially important for patients after head and neck surgery with a history of swallowing dysfunction or obstructing tumors. Assessment and treatment for swallowing function is essential for patient safety and for the prevention of aspiration and possibly pneumonia. Some patients may even benefit by continuing swallowing therapy through treatment to support and preserve swallowing muscles that can become debilitated from the rigors of treatment. Strategy number 3, a referral to the dentist prior to the initiation of radiation therapy is critical for oral health. Mouth problems need to be taken care of before treatment begins. Serious consequences of not removing damaged teeth before treatment include osteoradionecrosis and radiation-induced dental caries. The dental team will check and clean the patient's teeth, remove damaged teeth, and perform needed dental work. Patients will be counseled regarding the importance of performing daily oral hygiene practices, including rinsing the mouth frequently throughout the day with a homemade saline baking soda solution, brushing the teeth with a soft toothbrush, and the use of a fluoride gel for life. If patients do not have teeth, mouth care is still important. Ill-fitting dentures should not be worn, and frequent rinsing of the mouth and good oral hygiene is still required. Patients will also be given daily exercises for maintaining chewing and jaw function. Strategy number 4, close monitoring while patients undergo treatment. Once a patient has begun cancer treatment, attention to their nutritional status and oral health should be a daily concern of the oncology team. At my institution and at other cancer centers, we perform a daily spray and weigh after each radiation therapy treatment. The nurse or dietitian first weighs the patient. A saline mist is then sprayed into the patient's mouth to assess for mucositis and possible oral infections. Supportive medications may be prescribed, and the nutrition plan may be revised. Being proactive helps to support patients through treatment. Strategy number 5, a referral to oncology rehabilitation services. Once patients have completed their cancer treatment, consider referring them for oncology rehabilitation. As patients transition from treatment to recovery and survivorship, they may need help in managing continuing effects of their treatment. Many may still have problems with swallowing, ongoing fatigue, and loss of strength and energy. Referrals to speech pathologists, physical therapy, or exercise programs such as the YMCA's Livestrong can help to improve function as well as quality of life. Thank you again for taking time to listen to this educational program and learning more about strategies for the nutritional and supportive care needs of your patients diagnosed with head and neck cancer. For more information and resources on establishing and improving cancer nutrition programs in the community setting, visit ACCC's website.